So this Insta lecture will be on leukocyte adhesion deficiency syndrome, LAD syndrome. And LAD syndrome, first I would explain you what are the key features of LAD syndrome, and then I would deep dive and would try to explain the certain characteristic features, unique features of LAD syndrome. That LAD syndrome is typically seen in infants and neonates, which is presenting with recurrent infection. It's an immunodeficiency disorder. And the characteristic feature of this immunodeficiency disorder, that at the site of infection there is absence of pus formation. This is a hallmark feature of LAD deficiency. We try to understand why there is absence of pus formation. Another interesting thing is seen is that there is a very high neutrophilia. The very high amount of neutrophil is seen in the peripheral blood. There is a high WBC count which is mostly made with neutrophils, and the neutrophil count could be 5 to 20 times higher than individual in the normal state. Actually, we would also try to understand why this happens. So some basics first. Mostly there are two types of LAD syndrome. Having said that, LAD3 type 3, which is also known as LAD type 1 variant, have also been described, and recently in 2016 even LAD type 4 has come. But mostly the LAD type 1 and type 2 that you need to know at this level. And out of that, LAD type 1 is the most important, because LAD type is the most common sin and most severely manifesting, actually, the manifestation. This is the key LAD type 1 that you need to understand. Now, LAD syndrome stands for Leukocyte Adhesion Deficiency Syndrome. So, as the name states, leukocyte is failing to adhere. Adhere to whom? Blood vessel wall. What is the problem with that? The problem is this, that leukocyte mostly remain, the neutrophils mostly remain inside the blood vessel, and if any infection or inflammation is going at the extravascular site, obviously they're going at extravascular site most of the cases outside the blood vessel, they need to come out of the blood vessel and go to that place and fight with them, the offending organism or the insulting organism or the agent. In this condition, that there is a failure in that, because the neutrophils, they cannot bind with the endothelium or the blood vessel wall, and they fail to come out of the blood vessel wall to reach the site of infection and inflammation. That's why the name is known as leukocyte adhesion deficiency syndrome. It's an genetically inherited syndrome, autosomal recessive pattern. Please keep it in mind that this is an autosomal recessively inherited syndrome. How does they present? They present usually with from the birth. You can see some problems are occurring, actually, like particularly there will be a lot of symptoms associated with umbilical cord, like there will be delayed sloughing of the umbilical cord stump. There will be recurrent infections of the skin and the mucosal surface. This would be the characteristic feature. There will be delayed wound healing, and there will be absence of pus formation in the site area of the infection. So these are the key presentation features of the LAD syndrome. Now we need to go in depth, actually, to understand more about LAD syndrome. To understand LAD syndrome truly, you need to understand the mechanism of acute inflammation. Basically, you know that acute inflammation, there are two responses occurs. Acute inflammation is basically mediated by blood vessels and the cells, inflammatory cells, acute inflammatory cells. So firstly, suppose if there is an on my cheek there is some infection going on, and how this area in my body would respond to that. Firstly, there will be some vasodilation in this area. Vasodilation means the blood vessels will become dilated. Why they would become dilated? Because the body want to send more its machinery, more amount of blood cell, more amount of inflammatory cell, like neutrophils, more amount of plasma protein which can fight, like immunoglobulin, in that area, so that they can fight complement, so that they can fight effectively to the offending agent in that area. So that's why there is a vasodilation occurs in the acute inflammation. And once the vasodilation occurs, the second vascular step occurs, the changes in the blood vessel occur, that is increased vascular permeability. The blood vessels need to become leaky so that the cells and the plasma proteins which are there, they can come out of the blood vessel and reach the site of infection or inflammation. That means body gets it's something like that it's like, you can think that a country is attacked by some foreign agents, maybe I can say. When the administration comes to know that, what would be the normal response? They would send their best commandos, their best military personnel to that area. So similarly, the body is trying to do that actually. That they know that this cheek area is now attacked by some bacteria. So they are trying to send their machinery, that is their inflammatory cells and neutrophils and complements, all these things which can tackle with that organism. That is the basic idea of this. And second thing, there are certain responses occurs from the inflammatory cells. What are these responses? In brief, actually, because I have discussed this in mechanism of acute inflammation, but brief, the steps are margination, rolling, adhesion, diapedesis or transmigration, chemotaxis, and phagocytosis. These are the steps which are seen in the cell. Firstly, the cells come to the margin of the blood vessel. This is known as margination. Then they roll over the blood vessel wall. It's called rolling. Then they adhere strongly with the blood vessel wall, the endothelium. Then they come out. That is called adhesion. Then they come out of the blood vessel wall. That is called transmigration or the diapedesis. Then they follow the chemotactic agents, actually chemotactic molecules, and they reach the site of infection, inflammation, and the phagocytose. These things. These are the steps of the cells which are occurring in the acute inflammation. Now, leukocyte adhesion deficiency, basically there is a defect in the rolling or adhesion. Rolling means that the cells, the inflammatory cells, actually they roll over it. They do some kind of gymnastic, like this kind of thing, actually over the endothelium. They roll over the endothelium before they adhere strongly to the wall of the endothelium, and then only they can come out of the blood vessel wall. So in LAD type 1, there is a defect in the adhesion. Why there is a defect in the adhesion? Because basically there is a defect in the CD18. LAD type 1 is basically an autosomal recessive disorder which has a genetic defect of integrin beta 2 family, which encodes for CD18. So if this defect is there, the leukocytes, the neutrophils cannot adhere to the blood vessel wall, to the endothelium. If they cannot adhere, there is a defect in the adhesion. That's why the leukocyte adhesion deficiency syndrome. If they cannot adhere, they cannot come out of the blood vessel wall. If they cannot come out of the blood vessel wall, obviously they cannot reach the site of infection. So all the neutrophils, though they have reached to the blood vessels nearby to the site of infection or inflammation, they are failing to come out of the blood vessel to reach that site. That is the basic problem here of the leukocyte adhesion deficiency syndrome, and in this case LAD type 1 syndrome. LAD type 2 syndrome is basically a defect in the sialyl Lewis, which is expressed over the neutrophils, and that mostly causes problem in the rolling. The rolling does not occur. If the rolling does not occur, the next steps would not occur. If there is no rolling, there will be no adhesion, there will be no diapedesis or transmigration, there will be no chemotaxis, there will be no phagocytosis. And even if the type 1, there is no adhesion is occurring, the further steps cannot occur. There will be no transmigration or diabetes. So net result is this in leukocyte adhesion deficiency, that all the neutrophils, all the inflammatory cells, they are reaching the blood vessel in high numbers into the nearby area where this infection or inflammation is going, but they are failing to come out of the blood vessel. The extravascular movement is not occurring because there is a defect in the steps of the acute inflammatory process. There is a defect in the rolling or defect in the adhesion, and they are failing to come out of the blood vessel to reach the site of infection or inflammation. That's why we are getting absence of pus formation, because to form pus there should be some neutrophils. So if we do a biopsy in leukocyte adhesion deficiency area in the site of infection and inflammation, we will be not getting any neutrophils. Why? It's very natural, as I already explained, because neutrophils have not come out of the blood vessel, they are staying in the blood vessel. And that's why in leukocyte adhesion deficiency you will be getting a very high count of neutrophils, because all the neutrophils right now are there in the blood vessel. None of them they are able to come out of the blood vessel to the site of infection or inflammation. So in a nutshell, leukocyte adhesion deficiency is basically a disorder which is characterized by failure of movement of neutrophils or inflammatory cells from the blood vessel to the extravascular site. This is a disorder seen in the infancy, characterized by delay in the umbilical cord stump separation, recurrent infection of the skin and mucosal surfaces which are caused by bacteria like Staph aureus, in some cases funguses. And this is all in a nutshell about the LAD syndrome. Thank you very much.